Good morning. Or maybe not so good if you woke up with nagging back pain. Have you ever gone to bed feeling great, only to wake up stiff and sore, wondering what went wrong? Don't worry, you're not alone. And we've got you covered. In this video, we'll break down exactly why your back hurts after a night's sleep. And most importantly, we'll walk you through 5 simple techniques to relieve your pain and get your day started on the right foot. Ready? I'm Dr. Evan Schwindt. Let's get into it. First things first, why does back pain strike after a night's rest? When you sleep, your body isn't actively supporting your posture. If your mattress isn't ideal, or your sleeping position isn't aligned, your spine might be under strain for hours at a time. Another culprit is prolonged inactivity. Of course, after lying down for 7 to 8 hours, your muscles and joints can stiffen up, especially if they're already tight from sitting or stress during the day. Lastly, fluid buildup in your spinal discs overnight can cause increased stiffness in the morning. While this is normal, for some people it creates discomfort when they first move. But don't worry, you don't have to suffer through the morning. Let me show you what you can do to fix it, starting with the basics. One of the easiest ways to protect your back in the morning is to learn how to get out of the bed correctly. Here's how. First, roll to your side. This reduces pressure on your spine. Then use your arms to push yourself up into a seated position, keeping that spine straight. Finally, swinging your legs over the edge to stand on up, keeping your core engaged. This method avoids twisting or sudden jerking, which can exacerbate your pain. Maybe you think about raising up in the morning and crunching your back, that's bad. Give it a try tomorrow morning. It's a game changer, keeping that spine straight. Now, let's jump into the first technique to ease that back pain, oblique breathing. Oblique breathing. Now, this simple exercise helps activate your core and take pressure off your back. Here's how you do it. Lie on your back with your knees bent. Place your hands on your lower ribs. Take a deep breath in, expanding your ribs outward, not upward, and slowly exhale and feeling your ribs compress. Repeat this for 5 to 10 breaths to engage your core muscles and to improve circulation to your lower back. Next up is the PNF pubis. PNF stands for proprioceptive neuromuscular facilitation. Now, this exercise targets muscles around your pelvis. Tightness can also contribute to lower back pain. To perform this, you're going to lie on your back, squeezing your hand against your knee, or if you can put a pillow in between your knees, holding in for 10 seconds, as hard as you possibly can, and then going out, even if it's just against your hands initially. Ideally, you'd have a yoga belt or a standard belt to go out against as hard as you could, but presuming you're stuck in bed, even just some nice pressure through your hands will be sufficient. So for this, 10 seconds in as hard as possible, 10 seconds out as hard as possible. You're going to do 3 sets of that. Now it is worth noting, when you squeeze in, you might get a pop or a cavitation in the pubic joint. That might actually feel a little bit uncomfortable initially. That's completely common and that should subside. Now here's a key takeaway. Don't rest too much. Movement equals medicine. It might seem tempting to stay in bed or on the couch when your back hurts, but too much inactivity can actually make it worse. Instead, incorporate light movement throughout your morning, like walking or gentle stretching, to keep your muscles and joints from stiffening up further. Now, getting through your morning routine can feel daunting when your back is aching, but a few simple stretches can make a big difference. Try these. A cat-cow stretch. Start on all fours, arching your back and then rounding it gently. Next, a pelvic tilt. Lie on your back, tilt your pelvis up and release. Then a knee to chest stretch. Hug one knee at a time to your chest to release your tension in your lower back. These movements help wake up your spine and ease stiffness, setting you up for a more comfortable day before you even get out of bed. Last but not least, let's talk about glute rolling and self-myofascial release. Sometimes tightness in your glutes can pull on your lower back, causing discomfort. Here's how to foam roll your glutes. So sit on a foam roller or a lacrosse ball with one leg crossed over the other, gently rolling back and forth, focusing on any tight spots. Now spend ample time on each side for the discomfort to reduce by half, which is typically 3 to 5 minutes, so likely longer than you might have been thinking. This helps release tension and improves mobility, which takes the strain off your back. Now, morning back pain can feel overwhelming, but with these tips and techniques, you'll be moving comfortably again in no time. Thanks for watching, and see you in the next one.